With all this said, then we come to ASCO this year and we hear about ABC06. Martin, so ABC06.
So ABC06 trial is actually a second-line FOLFOX chemotherapy versus FOLFOX versus a standard of care or best care, support care if you wish. And again, I think it started to show the positive results on the study. And specifically, if I recall correctly, the data specifically the data, if you don't quote me, it was 162 patients total. They were actually, most of those patients had a survival advantage on the FOLFOX regimen versus the best standard of care therapy regimen.
I totally agree with you. This is probably a little bit relatively early for us to look into ABC06 because we heard it, all of us, in abstract form and waiting for the data. And of course, one of the questions that was brought up is what actually Dr. Lamarca at that time brought up about chemotherapy, i.e. GEM-CIS resistant, GEM-CIS intolerant, and other categories. And we're waiting for the manuscript to see a little bit more of the delineation of that. But interestingly, with this kind of at least suggestion that there could be a second line approach, and by the way, there has been no other study that we're of, but there have been some retrospective looks. One of them was just published jointly by different institutions, being UCSF, Vanderbilt, and Sloan Kettering, is looking into the second line therapy. And of course, there is different approaches, among which FOLFIRI, sometimes intrahepatic arterial pump if it's available, etc.